All right, good morning. So welcome everyone to this special panel event about cannabis use in Ontario. Thanks to everyone who's joining us, whether it's in person or remotely. My name is Jean-François Crépeau, and I'm a senior policy analyst here at CAMH, and I am very pleased to be introducing today's panel discussion. So it's been a little bit more than 4 years since Canada passed legislation legalizing non-medical cannabis, and right now the federal government is reviewing the Cannabis Act, and there are debates across the country as to whether the system's working. Today we'll be exploring this question using the most recent data from the CAMH Monitor, a survey of mental health and substance use among Ontario adults that was first conducted in 1977 and is the longest ongoing survey of its kind in Canada. Quickly, a few housekeeping notes. First of all, just please note this event's being recorded so we can share it with folks who weren't able to join us today. And second, there'll be time for questions from the audience at the end. We'll take questions in person and also through the WebEx chat. So if you're joining remotely and would like to ask a question, you can go ahead and send it in at any time. Before we start, I'd like to acknowledge the land we're on today. CAMH is situated on lands that have been occupied by First Nations for millennia. This site where we're gathered today appeared in British colonial records as the council grounds of the Mississaugas of the New Credit, as they were known at the time. Today, Toronto is covered by Treaty 13 with the Mississaugas of the Credit. It's home to a vast diversity of First Nations, Inuit, and Métis people who enrich this city. CAMH is committed to reconciliation, to honoring the land through programs and places that reflect and respect its heritage, and to sharing and protecting it for future generations. Many of you are attending virtually or are elsewhere in the province or country, so if you'd like to, feel free to acknowledge the land from which you're joining us today using the WebEx chat. And now it's my pleasure to introduce our moderator and panelists. Starting with our moderator, in the middle we have Pauline Chan, who's a video journalist for CTV News Toronto, specializing in health and lifestyle reporting. You'll see Pauline on the anchor desk, where she's worked for the past 25 years. Starting on my right, we also have Dr. Hayley Hamilton, who's a senior scientist with the Institute for Mental Health Policy Research at CAMH. She's an associate professor in the Dalhousie School of Public Health at the University of Toronto and co-director of the Collaborative Specialization in Addiction Studies at the University of Toronto. Dr. Hamilton leads the CAMH population surveys of youth, the Ontario Student Drug Use and Health Survey, and adults, the CAMH Monitor. Dr. Leslie Buckley is Chief of the Addictions Division at CAMH and an addiction psychiatrist who specializes in providing outpatient treatment for substance use disorders. She has a special interest in health system innovation in addiction treatment and creating collaborations to enhance care for people seeking help with substance use. Next, we have Riley Goldsmith, a youth engagement specialist at CAMH. As a disabled autistic adult who has direct and extensive experience with the mental health system, Riley hopes to further research and understanding of the intersection of disabilities and mental health. And last but not least, Dr. Jürgen Riem, who is senior scientist in the Institute for Mental Health Policy Research and in the Campbell Family Mental Health Research Institute at CAMH. He's professor and inaugural chair of addiction policy in the Dalhousie School of Public Health at the University of Toronto. Dr. Riem is a leader in generating and analyzing the scientific data needed to inform clinicians and policymakers of strategies to reduce alcohol, tobacco, and other drug-related harm. So without further ado, I will turn over to Pauline. Please join me, though, in welcoming our moderators and panelists.
Well, thank you so much, everybody. And as you can see, we've got a wide range of points of view represented here on our panel. We're going to start out with some general observations and background on the Monitor report, which covers 2020 to 2022, so it's the entire pandemic period. And we're going to start with Dr. Hayley Hamilton. What are some of the trends that you are seeing in that Monitor from 2020, my goodness, 2020 to 2022?
Sure. Data from our most recent 2022 Monitor has indicated some similarities between 2020 and 2022 with respect to, for example, cannabis use over the past year. Cannabis use for medical purposes, lifetime cannabis use. Where we have seen changes, however, or differences, is in the proportion reporting high risk of moderate to, in the proportion reporting moderate to high risk of cannabis use problems. We saw in 2020 around 16% reporting high risk, and in 2022 it was about 19%. when we look at cannabis users, particularly those who reported using cannabis, the proportions are even higher, around 55% reporting being at moderate to high risk of cannabis use problems, and around 64% in 2022. So those are the main changes that we've seen between 2020 and 2022 with respect to cannabis use.
And we'll be getting into details about those figures and what they mean a little bit later. But right now, Dr. Leslie Buckley, we have heard about an increase in cannabis use and problems. Can you tell us exactly what cannabis problems look like and who is at particular risk for that?
Sure, thanks for that question, Pauline. Cannabis is complicated. So cannabis impacts different people very differently, and people use cannabis very differently. So we have people who are using cannabis for medical reasons, and there's evidence that cannabis can be helpful for chronic pain, muscle spasticity in MS, and for appetite stimulation in chemotherapy, for instance. We also have people who are using cannabis in a way we might term, recreational or social. And so that means that there may be limited harms to the use. We know that over time, just like we've learned recently with alcohol, that there's always incremental risk over time. And also a risk of sort of moving on to another level of use. So the third type of use is problematic use, or what we might call a use disorder. And that's when cannabis is really getting in somebody's way. And you might see consequences related to that use and difficulty with control. So even though someone might want to make a change or reduce their use, they're having trouble doing that. And sometimes they're having trouble seeing that. And that's what maybe family or friends might be more concerned than the person in identifying it. You also ask about risk, and there are people that we identify as being, higher risk. So anyone who's driving, of course, should not be using cannabis. It takes 6 to 8 hours. It takes longer than people think to have cannabis out of your system. And people generally, assume that they can drive better than they can. So that's a really important thing to note. Also, people who are pregnant. So we know there's neurodevelopmental problems that are associated with cannabis use in pregnancy. So it's another important piece of information to get out there. We also would like people who have family relatives with a disorder related to psychosis. So those folks would be at higher risk of higher harms with cannabis use. And then most importantly is youth. So we know that, even up to the age of 25, the brain is still developing. And we know that cannabis has a greater impact on the brain of youths. We know that youths who are using cannabis have a higher likelihood of developing dependence than adults would. So we certainly, want to make sure that we know those harms are out there.
All right. Thank you so much. And thirdly, we're going to turn to Riley, who is our mental health advocate and youth. And you've had your own experiences with cannabis use. How does your own lived experience compare with the data that we are seeing today?
So I am actually sort of a late bloomer when it comes to cannabis use. I only started using it in the past couple of years. Even throughout high school, I had never even touched it. I was really uneducated on it. I didn't understand it. My first real interaction with cannabis was being prescribed by one of my practitioners to help with chronic pain, a connective tissue disorder that I have, as well as mood, anxiety, and other mental health disorders. But even once I was prescribed, I still waited a year to take it for the first time because of my fear and lack of understanding on it. And then in 2022, when a lot of my health struggles really increased, as I feel a lot of youth probably during the pandemic did, I increased my use of cannabis, finally taking my prescription. And over 2022 using that, I really lost a lot of my fear of it. I did a lot of internal education, a lot of looking at the research, which is still surprisingly lacking despite being legalized in 2018 in Ontario. But now I use it regularly, recreationally, and medicinally for my own health, but also I do a lot of work to try to spread awareness of what cannabis is, what it isn't, how it should be used, and who should use it.
All right. And I guess we're doing some of that educating today too,
I
right?
hope so.
So we're going to move on to some of the topics regarding cannabis legalization, which, as you mentioned, in Ontario was around 2018. Riley, we're going to start with you. Young adults, those under 25, are especially at risk for cannabis-related harms. On the other hand, many people feel that they do benefit from cannabis use. How do young people navigate this? And do you think that legislation has affected young people's perceptions of the risks and benefits of cannabis use?
Well, obviously that's a really tough question to answer. First, I can only speak for myself or people who identify similar to me. So I can't speak for all youth, especially on the topic of cannabis. I can only say for myself and my observations. But I think that like any other medicine, like any drug, it's going to be useful for some people and it's going to be harmful for others. One of the reasons that youth are especially at risk for cannabis misuse is because youth are generally most at risk for a lot of things. And this is no different, but I think that that's part of the positive perception changing, is that we're looking at cannabis not like, oh, it's this scary drug that we have to keep away from our youth, which often makes youth want it more, but it's instead showing them that it's not something dangerous. Like I said, educate yourself, and that perception is changing with the legality now that we can have these open conversations. So is it harmful for youth? Yes, but it is also helpful. Like I said, I wouldn't have been prescribed it if it wasn't, and we have to be aware that each singular person is going to react differently, like with any medicine.
All right, thanks so much, Riley. We have Dr. Jürgen Rehm, which we haven't heard from you yet, but we're going to ask you to right now. The federal government gave itself two main goals with legalization, and the first is protecting young people and eliminating the illicit market. To what extent do you think they are reaching those goals, or falling short, or somewhere in the middle?
Well, unfortunately, they're falling short. The objective was set very high, and in the years leading to legalization, you couldn't get into Parliament and hear any of those discussions with sentences like, we will be sure to protect our youth more than it is protected now in 2016. Well, let's look at what happened. First of all, what were the dangers seen from, especially for youth, in cannabis use, in the way to procure cannabis use? Well, first danger was, of course, the illicit market. How much was the illicit market being cut down? Obviously, with cannabis being legal, the illicit market went down, but despite all of those promises, we still in Ontario, for example, have more than 40% of the cannabis sold illegally. That is clearly not, after so many years, not a very positive sign. If you want to cut down the illicit market, you'll have to do it. That means that a lot of youth is still exposed to the illicit market. The second point is that it was said that with the legal market, youth will use less, and there will be less, and that's most importantly, negative consequences like cannabis use disorders. The data for Ontario right now do not indicate that we have less cannabis use disorders or less cannabis use. In that sense, it also fell short. There are positive signs, and she had already mentioned them, so I will not repeat them. So overall, it is clear that it was a very, very ambitious goal in the beginning, maybe a little unrealistic given the experiences in the world, and not surprisingly, Canada fall short.
All right, thank you very much. We're going to go over this side now to Dr. Haley Hamilton. You gave us an overview of the trends since 2020. Can you tell us a little bit more about the longer-term trends? How has cannabis consumption and the problems related to that changed over the past decade?
Well, we've seen clear differences and increases in cannabis use over the past decade. And you know, we have to admit that normalization of cannabis use has been occurring long before legalization. If we look back to around 2013, 2014, we saw from our data about 1 in 7 adults reported using cannabis in the past year. And then in about 2017, I think that number went up to about 1 in 5, and then it went up to about 1 in 4 by 2019, and now it's about 1 in 3. So we've seen that steady increase in cannabis use over that time period. When we look at cannabis use problems or being at moderate to high risk of cannabis use problems, again, you see that increase going from around 6% in around 2013, 2014 to what it is now, around 19% over time. And similarly, with those who were, among those who were cannabis users to begin with, we see that increase again over that time period. So, you know, clearly there has been an increase, but again, normalization has occurred over that time. And if we look specifically between 2019, pre-pandemic, and now, again, there's that clear increase in use over time, over that time period as well.
So it's a clear trend going upwards. Do you anticipate that trend continuing?
Well, that's why I think we need to continue doing research and surveillance to see what happens over time, and especially within certain subgroups. I think it's important to continue to do that, because right now, legalization is we're still in early stages. We have a long way to go, and it's important for us to continue to see what is happening, because I think it tells a lot, and it gives guidance to what policy changes might be needed to move forward.
Mm-hmm. All right, thank you. And Leslie, has legalization made it easier to have conversations about cannabis use and the associated risks? And I think one of the things that you might want to mention as well is cannabis today is different from cannabis 20 years ago.
Yes, thank you. I think stigma has positive, or like reducing stigma has positive impacts for people seeking help, from a doctor or from a place like CAMH. And I think it also helps young people be able to talk to their parents a little bit more. And we know that's a really important and helpful piece for youth to be able to do that. It's, I think that we've, in reducing stigma, we have to at the same time increase education. And, cannabis is very complicated, and there is some misinformation out there, right? We have to remember that cannabis is a retail product. And so there could be forces that drive people wanting increased use of wanting people to use more cannabis. So we have to be aware of that, and we have to provide, in this shift from a legal lens to a wellness lens, we have to provide helpful information for people and really increase that understanding. And to your point, Pauline, one of those pieces is about potency of cannabis and thinking about how much that has changed over time. And just to give information to this group, cannabis has many different components, but the two that we hear the most about are CBD and THC. So THC is the part that is rewarding. So that's the part that causes the positive euphoric feeling. It's also the part that sort of creates the reward and the dependence, potentially. Back in 1970, THC was about 3%. And CBD, which some people believe, the jury's out, we need more research, but it can be a little bit counteractive, so there's potential that it might be helpful part of cannabis, was 3%. So 3% and 3%. today we're seeing products that have as much as 80% potency, and that's easy to access. So that is very worrisome. You know, it's a different substance, and so we might have ideas in our mind about what cannabis is, but what we see is, you know, really impactful substance use. That's very, very powerful, and I think it's really important we make sure to share that kind of information widely.
All right. And perhaps we can sort of share this next topic with Riley and Dr. Rem. Over the past couple of years, there have been public debates about the number and concentration of cannabis shops across Ontario and in Toronto in particularly. Do you think legalization has changed how people access and use cannabis? And what are your observations about the retail landscape? CAMH has made many recommendations over the years about how to sell cannabis legally. How is Ontario doing in that regard? So I don't know, who would like to speak first? Riley?
Well, first, like I said earlier, our especially youth perception of what cannabis is, how to access it, has absolutely changed because of the legalization and because of the retail market. Over the past 5 years, we've really seen cannabis shops popping up literally all over, and I'm not exaggerating when I use the word literally. It's everywhere, and it's become as ubiquitous as Starbucks, which is, you know, it's an interesting point because we're trying to teach people that it's not scary, but it is still a drug. So should it be shown to people that it is the exact same? No, and we're already seeing with the, you know, economic status of cannabis businesses coming up and then coming down, it's not a sustainable economic practice. But ultimately, I think that once it finds its footing and finds a real safe, proper way to be selling this legally, it could hopefully reduce the number of illicit places to access potentially unsafe cannabis.
I do find that curious because, Dr. Rem, you mentioned that, you know, it's still 40% of illegal sales of cannabis, and yet we've got all these stores on every street corner. It doesn't seem like it makes sense.
I don't think it makes sense, to be frank. First of all, I mean, one of the arguments, and I guess one of the arguments why those illegal stores are not eradicated by police, I mean, there is a legal means to do so, is that when all of those debates about cannabis legalizations were done, and when we were invited into a town hall, it was always argued that cannabis already has so many people working in the cannabis business, and not legalizing it would actually make those people get unemployed. That was one of the arguments which was made very forcefully to the mayor and to the politicians. And that continued. However, obviously, the legalized cannabis will go its way, as in alcohol right now, we have 10 companies owning more than 80% of the global alcohol market. And in cannabis, we will see concentration, obviously, on a way lower level. And that will mean efficiencies, more stakeholder values, and less people working. So if it's legalized, it will get a lot of people unemployed, and that is what nobody wants to risk right now. And that is actually being pitted against the public health safety of the people. When I left my home and came here, in the first 5 minutes of walking, and I'm living in Kensington Market, which is not typical, I know, in the first 5 minutes, I was passing 7 cannabis shops, 4 of them illegal. And not all of them were visible. I mean, I know them, of course, but, and some of them are starting to do away with not showing cannabis products in their storefront, etc. So right now, we are currently in a set where what we actually predicted would happen, that there will be a concentration of legalized cannabis with a few companies, with less stores, has not happened for a number of reasons. But as long as illegal cannabis continues, and as long as there's a big pressure on both legal and illegal cannabis to produce and to make money, and that is the same for legal and illegal markets, we will have this problem that they want to sell more and more and more. So if this situation continues, we will have further increases in cannabis use and in cannabis-related problems and in cannabis use disorders. And there's already mentioning that cannabis producers are standing in line in front of Trudeau's office saying, do away with those stupid public health rules, do away with a ban on marketing, do away with that because we need that. Cannabis is one of the industries where cannabis is #1 in the world. We have to keep that. We have to have a test market. And for that reason, we need more cannabis sales. We need to try different methods of marketing, which we then can use in other countries. So we are in a situation right now at the crossroads. We really have to decide what we want to do. Do we want to continue to have legalized cannabis with strict public health control, or don't we want to do that? And that is a decision where I'm not too sure about the answer, what Canada as a country really wants.
It's really interesting to consider what forms of marketing, because if you compare it to things like alcohol and tobacco, you know, we can't advertise for tobacco. There are some ads for various kinds of alcohol beverages, and they make it seem very sociable and relaxing. And those are some of the qualities that many people find attractive about cannabis use as well. Do you have any thoughts about the forms of marketing or restrictions on marketing that you'd like to see?
Oh, well, very clear. For all psychoactive substances, the WHO has the best buy of a complete ban on marketing. So there should be a complete ban of marketing. Currently, if you look into the marketing numbers, and there's not a lot of differences between the industries, more than 50% global money in marketing is going into digital marketing, very clearly. So basically, what they want to do is to have the right to digital marketing. For example, if I'm an alcohol researcher, that's my main line of research, I would say. And of course, I'm using Gmail, I'm using Google. Guess how many ads do I get for alcohol? Because what I'm doing is, of course, known, and they can do personalized marketing. So what they want to do is, oh, Jürgen, it's your birthday. Why don't you have a nice relaxing joint to start the day? Those are the kind of personalized marketing they would like to do, and those are the kind of marketing which has been shown to be best to create implicit attitudes which are positive and which are linked to behavior. And that's what we as public health people are trying to prevent. So very clearly, for all of those substances, we would like to have a complete ban of marketing, classic media, social media and other digital media, events. I mean, we don't want Heineken to sponsor our jazz concert. And also the out-of-door media with cinemas, posters, etc. So that is, from a public health point of view, the most effective way to reduce potential harms from psychoactive substances, alcohol, tobacco, and cannabis. Sorry to be so long.
No, not at all. I found that really interesting. We have a few sort of general topics of discussion because up till now we've been generally doing answers from each individual, but we do want to be able to mix things up a little bit with interaction between all of our panelists. So we would like to look towards the future, and I did ask you, Dr. Hamilton, about where do you see the trend going, and you are very good about not really saying if you think it'll continue going up at a steep climb or decrease that angle of use. But what do each of you on the panel here, what do you think is working well? What aspects of legalization do you think have been the most successful? And I don't want to sort of pick a first person to start speaking, so choose amongst yourselves. Talk amongst yourselves. Anybody want to volunteer to start? All right, go for it, Riley.
I think that one of the things that we are doing well is increasing education around cannabis. As I said, even just from my personal experience, growing up, I was pretty sheltered, and
Which I think is a little unusual that you were so late in trying cannabis, and I can't talk because I probably had a very similar background to you. But a lot of teens, you know, by the time they hit the age of 20, I don't know what the percentage of teens who've tried cannabis would be, but I would imagine it's higher now that it's legalized?
A little bit higher, yes. It's usually
Do you have
1 in 5, 1 in 4?
1 in 5, 1 in 4 teens have tried
Have
cannabis?
used in the past year.
Have used in the past year.
Oh, sorry. I felt as if I was speaking to Pauline personally.
Well, we want to have a conversation, definitely.
There you go. Yes, for youth, it's right now, it's about 1 in 4, 1 in 5 since legalization happened. That's been around, you know, used in the past year specifically.
Interesting. Sometimes the media makes it appear like it's a higher percentage than that.
It's not just the media, it's also the teens themselves who tells their parents that everyone uses cannabis, but that's not true.
All right. Good. I'm a parent, so it's good to have that kind of information.
I absolutely feel like when I was in high school, I was for sure going home telling my parents, everybody's using it and I don't understand and I don't know what it is. But I mean, like I was saying, the education of it, the post-legalization of it, for those 2 years, 2018 to 2020, once it was legalized, I was prescribed it, and I still didn't take it because I had spent my entire life not understanding it, not being educated on it. The best thing about the legalization is that you can educate people like me who can find a benefit of it but refuse to because of the global fear and sensationalization of cannabis use. Once we educate and desensationalize it for our youth, they stop being afraid of it, they stop thinking it's cool to do and stuff. It becomes potentially another medicine, just like other drugs that we use. That is, I mean, for me anyways, I don't know if the rest of the panel feels the same. That's sort of my goal for being here, what I want to tell people. So I hope that I made that clear.
Can I ask, what exactly were you afraid of about cannabis use? Were you afraid of addiction? Were you afraid of, you know, not being able to control the effects?
Yeah, probably like globally a bit of both. Ultimately, just for me, it was the idea that was sort of given to especially like young, sheltered white people like me, like cannabis, it's really scary, it's this whole thing, and, you know, bad kids do it because it's illegal, and that's not true. And I think that post-legalization, we can tell people with the results of CAMH Monitor and everything just how untrue those beliefs were to me.
Yes. Did you
So-
want to speak, Dr. Buckley?
It was great what you said, Riley. You know, I think that's the benefit of reduced stigma and having people not, you know, internalize negative thoughts because they're using cannabis. And then I think the other benefit is the legal piece. So, you know, people who have received charges for possession of cannabis and how impactful, we see how impactful that was in the past in terms of interfering with recovery or change and, you know, impacting someone in so many ways. I think what we have to be careful about now is recognizing that when you go on vacation to another country, making sure we realize that, you know, checking in on the laws there because people are very used to what happens here. Somebody who's using every day, it's hard to stop, right? So we have to be mindful about thinking about other countries at the same time as we're, you know, appreciating the benefits of people not facing those charges, which sometimes, you know, occurred more frequently with people who were from a marginalized community. So that's important.
If I may add just to that aspect, what changed, of course, also is the discrimination of certain groups within our society, like racialized groups. In Toronto, we had a situation where police were picking up, just for control, way more black people, way more minority people, even though those people de facto had a lower chance to smoke or possess cannabis. But they were, the stereotype was different. And these practices now are having not fully stopped, but are slowly going down for all we know. So a destigmatization and a more education are the two positive sides.
All right, that sounds good. If we're going to look at the flip side of that, we looked at what is working with the legalization. What is not working so well? The federal government is currently reviewing the Cannabis Act, and the retail system, which seemed to be the most contentious aspect of legalization, is under provincial jurisdiction, however. So what advice would you give to the various levels of government going forward?
Well, very simple, eradicate the illegal market. There are ways. We are not speaking about shops and which are not known. We just choose not to do anything about them. That is the problem. Second of all, keep public health laws. Do not eradicate and slowly melt them down. And that's not only, that's of course for each of the provinces. Thirdly, think about things like density laws. Do we really need one legal cannabis shop every 50 meters in Kensington Market? I don't think so, but that's maybe my opinion. And fourth, be not colonialist in the sense that now that Canada has one industry where they're global number one, they can actually do completely different and slightly immoral practices in other countries. We have seen that before with tobacco, that Canadian prime ministers went to China and said, well, you know, we have pretty strict cannabis laws, but tobacco laws, but we give it to you for a lower price, so we can let more Chinese die instead of Canadians. I don't think this is worth just having a global number one in one of the psychoactive substances. We should keep relatively same practices throughout the world. Those would be my recommendations.
All right. Anybody else want to go? Do you want to go, Dr. Buckley or Dr. Hamilton?
I think my area of focus would be increasing access to treatment. So although there is some education, I think we need more education. And we certainly need more education about when and how to access treatment, and then provide that treatment in a way that, you know, reduces waitlist times, which may require, we see a lot of benefit here of having a cannabis-specific program. So people who are using cannabis are being treated with other people who are using cannabis and want to make a change. And I feel like that is a very big gap, that access to treatment. And so we should be focusing on, on increasing our programming and increasing our brief interventions earlier, because we really want to stop the transition, right, from use that might be recreational to use that is causing consequences for people. And I think that's an area to focus on.
Mm-hmm. Dr. Hamilton?
I would say resist the competing interests. Public health is paramount, in my opinion, and we know that there are competing interests. We know that there are stakeholders out there, as was indicated earlier by Dr. Reeb, wherein they are trying to get changes that would favor them and their interests. So it's to, again, keep public health in mind and recognize that that was the original. There was an emphasis on public health when we started, and that should be maintained. So, you know, the competing interests of the additional stakeholders, the retailers, the owners, the growers, industry, period. Try our best to resist.
So that would be for all three levels of government then, I guess, because they all have their health interests and departments.
Absolutely.
Whether it's zoning for cannabis shops or public health. All right. Thank you so much for all of your thoughts on that. We would like to open things up now towards having questions from our audience here, and we also have a very large group of people who are online and following this discussion. So please do send in your questions, and we will be able to get them to our panelists and maybe figure out who's the appropriate person to address the various topics. Are there some people here? We have two microphones in the room, one at the back and one on the side here where the window is. Are there any questions that people would like to ask of any of our panelists, or perhaps even all of our panelists? Hi.
Can you hear me? Okay.
Can you tilt it down? Would that make it a little more comfortable? There we go.
There we go. Okay. You spoke about treatment and for a cannabis use disorder, and I'm recalling, you know, when I was first exposed to cannabis in high school, and one of the things that made it feel more approachable than other substances was there was this myth that it's not addictive. It's the one drug that you can't get addicted to, and that made it feel more approachable, less scary for high school students. That's obviously a myth, and I wonder if you can just, if you can share a bit about where that myth came from and debunk that a little bit.
Sure, that's a great question about where that myth came from, and I'm thinking about, you know, perhaps some wishful thinking. Perhaps also because there was sort of wide use at one point at a time when the product had a low potency. So what may have been more true back then is less true now in terms of the, you know, sort of like rate of capture, or like the transition again from recreational use to a more of a dependence picture. One of the interesting things about cannabis, and I think it's a challenge for younger people, is that a lot of times something that keeps us from progressing with our substance use are things that get in the way. And so for young people with alcohol, smelling like alcohol at school, or being very disinhibited and it being noticeable, I think is a barrier. There may be less of a barrier with cannabis in terms of, you know, it's less noticeable. With certain, you know, with vaping now, there's not a smell of cannabis that stays on the person. So I think, and you can sort of get by and still be in school and not noticed and use a substance every day. Whereas it's very hard to use alcohol every day. So I worry about that, the fact that it could be more tricky and insidious and become dependence before someone realizes it is. But thank you for that question.
If I may add just one sentence. I think it was also a reaction to some of the very early attempts against cannabis by the government. You know, reefer madness, this completely overblown characterization of cannabis that if you take one joint, the next day you're already dependent and psychotic and running around. Those kinds of reactions against this really hyped up dangers of cannabis were then unfortunately countered with, this is sociologically correct but or explainable, but it didn't help to have those two extremes. The reality is in between. One of every 7 or 1 of every 8, whatever, who starts using cannabis will become addicted. That is a relatively high number, but a lower number than other substances. And one of the advantages of the situation now is that we can very simply speak about numbers. We can tell those numbers, and we don't have to go into extremes without falling into the trap of, oh yes, he is a blah, blah, blah legalizer or whatever.
Okay, we have another question here, I think, within the room.
Yeah, hi, thank you. I was curious now that marijuana is legalized, cannabis is legalized, why is there still so much illicit purchasing and use? Is it a difference mainly in price? Is it in the product mix, as you were discussing the potency? Because I would think it would eventually move towards sort of where alcohol is, that it would become just completely used by legal side, or is there a regulation aspect that's a problem?
Two things. First of all, price. Very clearly, once you have a legal substance, you have taxes. These taxes are added, and illegal substances are still cheaper. Secondly, there is in some of those stores higher potencies and less control, where the user believes he or she gets higher potency or better stuff. Those are the two main things. Price, I would say, number one, and the belief that better products, higher potent products, can still be bought illegally.
Does the higher potency, and forgive me, perhaps this might be widely known already, but does higher potency make you higher? Does it make it last longer? Does it make a difference for the user? If you, I mean,
Sorry, I'm happy to answer that. It does make a big difference. You know, it's the speed and power, right, of the substance have an impact on how the person feels, and also on how that over time might progress to something they become dependent on. And then even more importantly with cannabis, the potency is related to harmful consequences like psychosis. So we can see that, you know, there's an increased risk for those who are using high potency, high frequency. So that's an area we really want to identify and help people seek help earlier rather than later.
we have another question here within the room. Hi.
Thanks very much. It's been a long time since I was at university, but I've heard from friends, my kids are not yet there, but I've certainly heard from friends who have kids in university that cannabis is actually the substance of choice in our universities and in colleges. So I wonder, A, if that's true. Secondly, if assuming there is greater substance use in our universities and colleges, what would you do if you were the president of a university or a college to try to protect those young brains from substance use problems?
Shoot, well, I feel like as the youth, I sort of have to answer this one. Well, I've actually been out of school for a couple of years, so tough to say from an observational standpoint specifically. I don't think it's surprising. I think even when I started university, I was there for a year and a half, and during that second year was when cannabis was legalized in Ontario. And interestingly, right when that happened, I didn't actually see that much of a difference, which kind of goes to what you were saying. People are still going to be getting from where they were before, potentially. It doesn't surprise me that it would be sort of the, I don't know, thing of choice for people, because it is still new, right? Like, I mean, I said it's still very sensationalized. We're still kind of in the woohoo, it's just been legalized state. We'll get out of that eventually, I imagine. And if I was the president of a university, which I'm not, but I would probably, do the same rules as with alcohol. Like, I mean, it's not perfect, but alcohol is, we have quite a bit of data. We've been consuming it as humans for a long time. We understand it probably a lot better than we do cannabis at this point. And if we treated it similarly, would it be perfect? No, because people still drink at universities too. But that's the best that you can do with what we have right now. Feel free to disagree.
Other thoughts?
I don't disagree. It's a
Okay,
really
thanks.
fun, great question. I think that it's nice to partner, to be a clinical person amongst researchers, because sometimes we see things early and we can make comments. I feel like you are right, that I think that cannabis is becoming maybe even the first substance rather than alcohol that people try. But I don't know, because I'm just taking this anecdotal information from the people I treat. So I lean on my colleagues and friends to do the research. So I think if I were the president of a university, which I also am not, I would invest substantial amounts of funding into my research team, who's looking at, these very important questions, including, prevention research. So you have to change, your tactics all the time, or your programming for prevention, because the context constantly changes. We have more anxiety now. We have to be mindful of that when we're thinking about our prevention. We have to change cannabis prevention, of course, because it's legal and the access is easier, right? So we have to be constantly innovating and changing and researching those innovations. And I would also increase the treatment accessibility.
Dr. Hamilton, any thoughts you want to share
Well,
with that?
I would go to the area of education, and that is increasing education. There's been a lot of education within universities about alcohol use. We've seen the detrimental impacts it has had at university level. So again, increasing education with respect to cannabis, because again, it's new. And I think at universities, whether it's being used to reduce anxiety, for studying, whatever, or just in a social environment, I think it still boils down to education and for people to understand what the potential consequences are. And here I think it's also important to mention edibles, for example, and the different modes of use, because if they are more likely to consume cannabis, eat cannabis in edible format, then again, the potential impact might be lost on them if they're not aware of the differences in the effects, or the instant effects versus the delayed effects, depending on how you use. So I think, for me, education would be an important way to go.
In addition, I would do some education very demonstrating. For example, one of the myths in current university is that you can still thrive after smoking 1 or 2 joints. This is already 3 years old, but to my knowledge, that hasn't changed that much. But overall, the majority of U of T students still believe that they can thrive as well after cannabis as before. And, we're just more cautious. That's exactly what the German people said when they started to ban alcohol in traffic above a certain blood alcohol concentration. Well, we are cautious. We can control it. You know, this kind of nonsense. You just use cannabis because it does something to your brain that you control less, and that's the whole reason why you use it. So one of the things I would do is I would put up 2 or 3 driving simulators, and those people who say that they can do it as well as before, I would actually test them, check if they have cannabis levels in their blood. If they don't, let them drive, let them smoke cannabis, and half an hour later, let them test again. And that would be a clear demonstration how bad their reaction time has been going down, and that they cannot control it, because reaction time is something you cannot easily control. And no matter how much you try, those kind of demonstrations, if you do them, may be more effective than 10 lectures of honored professors.
Honored professors, indeed.
I think that we, being at CAMH right now, it would sort of be remiss to not say one of the reasons that cannabis use in universities is so high is because of the mental health and the poor mental health and stress levels of university students. I mean, you were talking about access to help with cannabis misuse, and I 100% agree. And on top of that, mental health accessing treatment is so important, because that is one of the reasons why it is so popular. It is for de-stressing, it is for helping in social situations, it's for helping studying, to help focus, all of these kinds of things that if our students were not put in a position where they feel like they need drugs to perform better or to feel good about themselves or to have better mental health, there would be a lot less misuse in university settings.
Self-medicating. Yeah.
Thanks.
All right. We have another question over on this side. And if we have any other questions coming in from, all right, we will have to get to those too.
Okay, I'll ask my question quickly. So as a parent to 2 young adults, transition age youth, hearing this sort of puts my mind into reefer madness and don't do drugs and stay home, but that's not the reality of our lives or our children's lives. So I'm curious what the messaging is to family physicians, to psychiatrists, to mental health professionals. Do we discuss harm reduction as opposed to prevention and treatment? Is there a discussion about safe cannabis use? Is there such a thing as safe cannabis use? Thank you.
Is that okay, Pauline?
Yeah, sure, go ahead.
A great question, and sometimes parents who may come from the 80s when there was less cannabis use will say to me, you know, I feel like the kids can talk circles around me. Like I have, you know, nothing I can say to them because I don't know enough. So one piece is to learn more, but that's hard. And then the other piece is, you know, just what is the risk of your, you know, of your particular child? So are they fitting in any categories? Like, I'll just disclose I have a family member with schizophrenia. So I have said to my children, they shouldn't smoke at all, right? But that's very different than somebody who doesn't have that family history. So I think it's very important to think about risks for your own child and then start that dialogue. And even if you feel like you don't have all the information and you're not necessarily guiding them, telling them what to do, which doesn't work very well with youth, just that your ears are open and you're listening to them and hearing their stories, their challenges, and their experience. And, you know, we all have a relationship with a substance, right? So they have you know, if they're starting to use cannabis or even thinking about it, they already have a relationship. And understanding that relationship and trying to be open and clear about potential harms. Young people tend to not want to see the harms or think that, you know, it's a lie, you know, about these harms. It's the, you know, the man trying to tell us not to use it. So just trying to work through some of that and then be mindful and watching. And I do have lot of friends who are worried about their child's cannabis use, right? And the impact on mood and how confusing that can be. And Riley so nicely put out, the information about how kids might think they're medicating their anxiety or ADHD, and there's an interesting lay terminology for this. So when you start a substance, it may feel like it's magic, like it's giving you benefits. And then after a while, it might, change as your brain changes and your relationship with the substance changes. It might be more like a medication, where you kind of feel like you need it to function. And then a third stage that, of course, not everybody gets to is misery, right? So when it's causing more harm than it's alleviating. And so just being mindful and able to watch and out for those transitions and have communication with your child is great.
Interesting, the 3 M's: magic, medication, and misery.
And there's one little information which may be helpful. There are safer cannabis use guidelines. So it's not safe cannabis use guidelines, but safer. And those are directed, and they exist even for youth specifically in youth language, and they have been researched with the sole intention, okay, we will not come into a society that there will be no cannabis use, but if you use it, how can you use it safer? And those safer cannabis use guidelines are actually something which had been pioneered in Canada by CAMH, and I think they should be distributed more widely.
All right, that's a great idea. I think we have a few questions now coming in from our online participants, so let's hear what we've got.
Yes, we have quite a few. This one is from Aaron. They're asking if you have a sense of how cannabis legalization has impacted co-use of cannabis and other substances such as alcohol in Ontario.
That's an interesting question. Any thoughts? Has there been research done on cannabis in conjunction with alcohol use and other substances?
Yes, there has been some, and I'm trying to remember, I think in our, I'm trying to remember what is included within our reports, because even though we might collect the data, it's not, you have to actually publish it. So within our reports, we talk specifically more about the more common substances individually, not necessarily looking at the co-use. But I believe in our Ontario Student Drug Use and Health Survey, I think there are questions there and coverage there within our most recent report related to co-use. So there is some data there. Again, when you're looking at the way it's used or the circumstances under which it's used, then you're more likely to be concerned about co-use, especially if it's a social situation with respect to they're socializing. Let's have a drink, let's use cannabis, kind of similar to smoking when you used to drink and smoke on the same occasion. So in a sense, yes, there would be more of that right now.
Mm-hmm. Any other thoughts? What are you hearing from any of the youth groups that you are speaking with? Riley, do you hear much about cannabis or do they speak only of one substance at a time?
I think that as Haley was saying, it's definitely more common in like the social sphere. I definitely am more in the medicinal and self-medicinal communities in terms of my observations. So actually in that area, I haven't observed a lot of both of those being used at the same time. Those specifically, with other drugs, I'm sure it is also more common, but I don't actually know that much.
All right.
Sorry.
All right, more to study, right? Do we have any other questions yet from our online people?
This is one from me, actually, and then we'll go back to the online questions. I know that we've talked about the need for more cannabis research and also the need for more education for young people. I was wondering if you could elaborate a little bit on what we do know from the research so far about cannabis, maybe its effect on the human brain. You talked about, some sort of link between cannabis and schizophrenia. I know that we have some research on cannabis and the evolving sort of youth brain as it, potential effects as it matures. If you could just elaborate a little bit, what do people really know? What do we know so far about, some of the effects of cannabis on the brain?
Happy to answer that. So you identified a few, really important areas where there is active research, and another area is looking at concurrent disorders. So, whether, there are studies that look at whether cannabis improves mood or anxiety or PTSD. And then there are studies that are looking at whether it harms mood or anxiety and PTSD. And right now, we have two big studies that looked at many different sub-studies, so reviews, and there was no evidence that there was help for anxiety, depression, and I think that that's an area where we need to look more and understand better and communicate better in terms of the impact of substance on mental health.
Interesting. We have someone online who has a question.
Yes, this one question here is, cannabis legalization was informed by studies on low-potency cannabis and smoking. How does the Cannabis Act address the future cannabis industry based on high-potency and innovative modes of consumption?
All right. I feel like this is, several years ago when we had more concussion research, it seemed like the information and the advice on how to treat was changing all the time, and parents especially, really had to stay on top of the latest research because it would change subtly from month to month and sometimes week to week. Is there someone who would like to tackle this difference in research from, the lower potency years to the higher potency years?
Well, I mean, there's at least one consequence very clearly. What we should try to strive in all laws, and that is to have an upper limit for THC content. And that was one of the reasons, actually, why we wanted to legalize it, to control that the THC content could not go above a certain degree. And this is clearly one of the consequences, that we should stay with that, and that this threshold should be successively informed by newer research. So we have what we believe is the best threshold now, but we should actually look into the research, how it evolves, and then look if we have to adjust this threshold. But very clearly, we should not go into allowing all sorts of THC contents. And some of the problems which we see with synthetic cannabinoids, which are way more potent in some aspects, is that there are very dangerous consequences. So we need to keep that in mind, and we need to have this threshold constantly being examined.
And do we have anything that compares the older studies with the more recent higher concentrations of THC?
Well, I think the thing that we can say is that we can't rely on that old data anymore. We have to create new data because it's a different substance in a way. And maybe, from the policy big picture, one of the themes coming out here is that there are a lot of positives with legalization, and I think that the public, agreed with that, and that's why it happened, in terms of polling. But I think that the theme on this panel, but I think it's also shared with the public, is that let's do it in a safer way. It's hard to regulate substances, and traditionally we've not been very good at it. So it takes a concerted effort. It takes a lot of energy to battle that, and we just have to get better at regulating, and I think the public would agree with us.
Do we have another question from our online group?
Yeah, I have another one here. Have we seen a proportional increase in the incidences of cannabis-infused psychosis associated with increases in use in the general population over the past few years?
I think that goes back to you, Dr.
Yeah, I think it's
Buckley.
a great question, and it's complicated right now. So there's different studies looking at it in different ways. So I'm hesitant to give you a final answer on that. But I think it's one of those areas we need to be watching very, very carefully and examining over time. And part of the complicated piece is that there have been other factors going on, like COVID. Right? So I'm sure that has affected Dr. Hamilton's research in certain ways. And so we have to parse out, the different factors. So it takes a little bit more time.
Dr. Hamilton, any thoughts on that?
Well, I mean, she mentioned COVID, and I think that's one of the issues. I think I mentioned it earlier with respect to the trends, and that is we're in the early stages of cannabis legalization, and then COVID happened. And so are the changes that we're seeing, to what extent are they resulting from legalization or COVID-19 pandemic? So, that's kind of confounding things right now. So it's going to be hard to pick things apart, which is why we need to, again, continue to do research to kind of try to separate those effects.
States, before COVID, when they legalized it, had more emergency room visits for psychotic events. That is something which we knew from before 2019, and again, there may be other factors, but the association is there, and the associations in Canada, nobody dares to interpret right now because of the specific situation.
I think that hopefully with the reduction of stigma and the reduction of stigma in both the mental health and cannabis use communities, we'll get more accurate results for, future research. It's not just that we're seeing these numbers going up because of what is actually happening, which is also true, but people are able to come forward, and that makes the research more accurate. So stigma reduction, very important.
Absolutely. We do want to make sure that we have enough time for a final statement from each of our panelists. Did you have a question, or I'm not sure who came up first to the microphones.
I'll ask. Curious from each of the panelists what their thought was on the legalization of cannabis prior to the legalization and what their thoughts are now, and if it's changed.
Can we do one sentence or one little answer from each person? Should we start with Dr. Hamilton?
Well, I think mine is the same, and that is just ensuring that we pay attention to youth. That was my concern prior to legalization, and it remains my concern, is to ensure that youth are protected and that they are not harmed as we continue this journey through legalization.
Any changes in your thoughts before and after legalization?
I think I'm a little more worried now. Even just thinking of the simple point of just how many places you can purchase it, just how many stores and how impactful that is for people I treat. They're bumping into them, and that's really hard. So I may not have expected that kind of a jump, and also maybe I would have hoped for more education, but I do see the benefits that I hoped would be there.
All right. Riley?
Prior to the legalization, I was really against it because I was very uneducated on it. Post-legalization, a couple of years post where I am now, I'm very glad because, the medicinal cannabis has improved my quality of life, so I consider myself very lucky. But above else, youth need to educate themselves. Everybody needs to educate themselves.
Mm-hmm. Dr. Rem?
I was pro-legalization for the reasons that it could be better controlled with public health. I had my doubts beforehand if as a society we value public health big enough compared to the other interests which Haley has said. And maybe I'm a little bit more worried right now about those other aspects. But in principle, I think we should, as Canadians, go for legalization with public health because that's the way to do it in a modern democratic society.
All right. And did we have one more question from our online?
Yeah, this one is on public education. So what is your opinion on the best or most effective ways to educate youth regarding use of cannabis and pregnancy?
Cannabis and pregnancy. I think youth tune into social media more than anything else right now, but let's hear our thoughts from the panelists. Maybe we'll start with you, Dr. Rim, and work our way the other way.
Well, I pass to her.
Thank you. I don't have a ton of thoughts on pregnancy. In terms of educating our youth, I really think it's just a matter of, like, I mean, we have a lot of drug education in our sex ed classes. They're often, you know, sort of intrinsically linked, and I think that the way people are educating in, you know, public high schools, let's say, and I agree, sort of we teach high schoolers about the dangers of alcohol and alcohol use in pregnancy, and I said earlier, I don't think cannabis should be any different. It should be educated to our youth with sort of the same, you know, cautions.
Dr. Buckley?
I'll repeat myself a bit in just saying I think we need to, you know, be innovative with prevention and think of new ways. And there's been a lot of struggles over time to find successful programming. And, you know, even programming that combines with anxiety and mood, right? So maybe tools and skills based, you know, is much superior to information and warnings for youth. So that would be one point. And then in terms of, you know, pregnancy, it's a lot of pressure on women, you know, and thinking about if somebody is, you know, using every day or feeling dependent or is dependent on the substance, like to just have to change in one day is very hard, and maybe partner doesn't have to change necessarily. And I think we have to be mindful of providing information and also not stigmatizing those women at the same time.
And Dr. Hamilton?
I would say, you know, go with the research, but, you know, engage with youth themselves to determine how best to get the information across to them, what works best for them. Sometimes we're not always the best people to dictate that, but engaging with youth, I think, in combination with the research knowledge that we do have, is the way to go.
All right. And I think we want to make sure that we have time for a final thought from each of our panelists as we wrap up our discussion today. I want to say thank you to everybody, the online participants and the folks that are here in the room with us today. Maybe we can start, I don't know, which side? Eeny, meeny, miny, mo. Dr. Rim, would you like to start with your final thoughts? What do you want to leave us thinking about as we wrap up our discussion on how are we doing on cannabis legalization?
Well, it's a classic example of a glass half full or half empty. And I think as public health people, we have to try everything to fill the glass, to actually fulfill the promises of legalization with strict public health control, and to make sure that we continue this specific Canadian way and to reduce the overall harm. That's all.
Okay. Maybe I'll flip over to the other side. Dr. Hamilton, what kind of final thoughts do you want to leave in people's minds now?
With respect to where we are, for me, it's hard to say. I think it's early, and I think, again, with confounding with respect to COVID-19, it's pretty hard to say exactly where we are. So for me, I will go with what I do, which is continue to do surveillance and monitor what's happening with respect to, you know, the public health.
And you've mentioned that these are early stages. At what point does it not become an early stage when it comes to legalization?
Well, I think we have a few more years to go, especially, as I mentioned, because of COVID-19, and because it takes a while for people to, and are they just experimenting now in the early stage? Are just experimenting, or are they really now adopting this for real, this behavior, or whatever behavior it might be, for real? And so for me, I think, you know, a few more years will give us a better sense of where we are.
Okay. Dr. Buckley?
I, you know, trumpet the glass half full, half empty, and I'm happy to see so many so much of the change being positive. And I think that this is an opportunity to really uplift public health. And I don't think our message has been heard. Maybe we have to say it differently. We need everybody, maybe we need to find a different way to influence politicians. But I think that would be our next goal, to make this work much better.
Mm-hmm. And Riley, final thoughts from you.
I'm very grateful to be here to advocate for a youth voice, because so often when we talk about youth and mental health especially, our voices are not heard. We're not brought to the table, but we're often talked about. So to be here, to be able to represent a youth voice, and to be, ask my opinion, I really, really appreciate it. And I hope that this discussion continues, and I hope that there is a wider representation of the future discussion, hopefully once we get more research, as you said, still so early. So once we get a little farther into it and hear everyone's voices and lowering the stigma about cannabis use, that's my hope, that's my goal.
Can I ask, what is your message when you're discussing with the youth groups? What is your message, like your golden rule or your overall message to them?
My overall message is mental health is health, echoing what CAMH says. If you are struggling, we are reducing stigma so that you can ask for help. That is why we do the work that we do. So really, my message is, if you need help, please, please get it. You deserve it, and there will be people here for you.
I think that's a great note to end on. Yes. So I'd like to thank all of our panelists, and thank you from me to all of you at CAMH for allowing me to be part of this discussion. It's, as you've said, very educational, and I'm sure it will continue to be for at least the next few years. And we look forward to hearing your next round of research next time around. Thank you.